Cannabis for mental health treatment, from ancient medicinal cure for mental illness to a modern marijuana miracle. Hi there, and welcome to our discussion on marijuana and mental health treatment. As many of you may already know, marijuana, or cannabis, has a long and fascinating history as a medicinal plant. It has been used for centuries by ancient cultures for various purposes, including the treatment of mental health conditions. In recent years, we've seen a resurgence in the use of marijuana for various conditions, including mental health issues like anxiety and depression. Now, before we dive into the potential benefits of marijuana for mental health treatment, it's important to note that research on this topic is still limited. Some studies suggest marijuana may be an effective treatment for managing symptoms of anxiety and depression, as well as improving sleep quality and reducing feelings of stress. However, it's important to use caution when considering marijuana as a treatment option. It is not a one-size-fits-all solution, and there are potential side effects to consider, such as an increased risk of psychosis, addiction, and impaired cognitive function. That's why it's always a good idea to consult with a medical professional before starting any new medication, including marijuana. So, what are the best practices for treating mental health with marijuana? First and foremost, it's important to know your strains. Not all strains of cannabis are created equal, and each one can have different effects on the body and mind. There are three main types of cannabis strains: sativa, indica, and hybrid. Sativa strains are known for their uplifting and energizing effects and are often used to treat conditions like depression and fatigue. Indica strains, on the other hand, are known for their relaxing and sedative effects and are often used to treat anxiety and insomnia. Hybrid strains are a combination of sativa and indica and can have a range of effects depending on the specific strain. It's important to do your research and talk to a medical professional or a bud tender at a dispensary to find the right strain for your needs. Another important best practice is to always consult with a health professional before using marijuana for your mental health treatment. A professional bud tender can help you determine if this is an appropriate treatment option for your specific condition and can provide guidance on dosage and usage. They can also help to monitor your progress and address any concerns or side effects that may arise. Experimenting with different strains can also be a great way to hone in on what works best for you. Every person is different, and what works for one person may not work for another. By exploring and experimenting with different strains, you can gain invaluable knowledge about the various effects of cannabis and become an expert on your own health in no time. Just be sure to monitor your usage and be aware of any potential side effects, such as dry mouth, dizziness, or impaired memory and concentration. It's also important to understand your personal and legal limits when it comes to using marijuana for mental health treatment. Make sure to check the laws in your area and be aware of any personal limits or boundaries you may have. And finally, consider the source of your marijuana and the potential for contaminants. It's always a good idea to purchase your marijuana from a reputable source to ensure you are getting a high-quality product. In conclusion, marijuana may have potential as a treatment for mental health conditions, but it's important to use caution and consult with a medical professional before using it. By following best practices, such as knowing your strains and monitoring usage, you can ensure a safe and effective treatment experience. It's also important to consider the legal and personal limits of marijuana use and the potential for contaminants in the source. Thanks Thanks for joining me in this discussion on marijuana and mental health treatment. I hope you've learned something new and have a better understanding of the complex relationship between cannabis and mental health treatment.